Hi, my name is Nura Awati binti Muhammad Yusri and I'm from SBH3. And today I'm going to talk about laminitis. Have you ever seen this kind of condition happen to your horse? Yes, this is laminitis. Let me explain more detail about laminitis. Laminitis is inflammation of the laminae of the foot, which is the soft tissue structure that attaches the confine of the foot to the hoof wall. The inflammation and damage to the laminae causes extreme pain and leads to instability of the confine bone in the hoof. Laminitis cannot be cured, but we can manage it. Laminitis can be happen if there are overfeeding, retained placenta, obesity, lameness which prevent weight bearing in one leg leading to laminitis to other legs, and trauma resulting from excess work on hard ground. There are two types of laminitis, acute laminitis and chronic laminitis. The clinical signs for acute laminitis are lameness, especially when a horse is turning in circle, heat in the feet, increased digital pulse in the feet, pain in the toe region when pressure is applied, reluctant or hesitant gain, in another word, walking on eggshell. For chronic laminitis, there are rings in hoof wall that become wider as they are followed from toe to heel, bruised sole or stone bruise, drop sole or flat feet, thick crusty neck, disc hoof, which are the result of unequal rate of hoof growth. For diagnostic, if you suspect your horse has laminitis, seek veterinary attention immediately. Depending on the clinical sign, your veterinarian might take some X-ray of your horse's feet to determine the degree of rotation of the pedal bone within the hoof, so that they can decide the treatment for your horse. Next is treatment and control. First, we can diagnosing and treating the primary problem. Next, dietary restriction. Stop feeding all grain-based feed and pasture. Feed only grey hay until advised by your veterinarian. You can also treating with mineral oil via a nasogastric tube to purge the horse digestive tract, especially if the horse have overeaten. Then, administering fluid if the horse is ill or dehydrated. You can also use other drugs such as antibiotic to fight infection. You can stabilize the horse on soft ground such as in sand or shaving to reduce pressure on the weakened laminate. Cooperation between your veterinarian and the farrier is a must. Your veterinarian may be able to advise you on a new therapist.